Of course, we now know that autism is not a single disorder. Some have also described autism as people with severe disability with learning difficulties, and of course, some university professors are also described as autistic. So it depends on how you look at it.
Communication area. So in language for social interaction would be one of the major differences. So that, for example, you can have, especially when you have people with Asperger's, for example, their communication might appear okay. So in other sides they would be okay, but the social interaction side will fail them. Okay, Dr. Bailey talked about the triad of impairment. So this will be the areas that we'll be looking at, and communication will be also focusing on these areas. Verbal and non-verbal communication, social interaction, creative or imaginative play. I mean, sensory sensitivity is also becoming a really very big issue.
For children with autism, it can be intervention as far as communication is concerned, or intervention on their behavioral adaptation strategies that they will need to be able to use to function.
Parenting. Autism is one thing that really sort of knocks you down as a parent. You do everything you can to make sure your baby is healthy while you're pregnant. If you used to drink before, you stop drinking. I stopped putting on nail polish because I read a paper that said nail polish had something to do with it. I stopped eating grilled fish because I read panga, that is grilled, can cause problems. I was very careful. And you do all of that, and being a medical student and looking forward to helping people get well and everything, and you're told your child has autism. And this is one thing you can more or less do not.
So we have to be educated. We have to educate ourselves and also know where we stand, because there are a lot of options in the autism world in regards to your belief. Africa. There's no prevalence, but leading countries, South Africa, Kenya, as we heard about, has done some really fantastic advocacy work, and there's some really amazing schools there. Nigeria, our neighbor, has done quite a bit. They have a lot of special schools, and they've actually come to Ghana on a couple occasions to talk about the services that they provide. In Egypt, actually, not recently, but in the past, they've published quite a bit on autism services there. Okay, so then West Africa, we're getting a little bit closer to our environment. Nigeria is leading the way in at least published documentation and trying to think what happened right before the behavior that created it. And these are some very typical things that create the problematic behavior. So scratching your nose, talking, smiling, crying, thinking, dreaming, your nervous system, breathing, anything you can think of along those lines that you yourself are doing, have done, will do, is a behavior. So the biggest challenge with kids who don't have language is that you don't know what they want. And so that's where the frustration comes from, the anxiety comes from. It decreases their frustration and decreases their anxiety, and then decreases everyone's frustration realistically, because as the parent or the caretaker, if you don't know what your student or what your child wants, it's very hard to know how to handle when they have a meltdown or a tantrum.